the substance treatment world was that there was a significant expansion of telemedicine to enhance substance use treatment services. Medication-assisted treatment, for those of you who don't know, are medications like methadone, like Vivitrol, like Suboxone that substitute for opioids and allow people to maintain their lives without further immersion in addiction. And one of the big problems that we had, and particularly in Ulster County, with access to medication-assisted treatment was that there were very few physicians and psychiatrists, very few psychiatrists to begin with, but physicians who obtain special waiver status from the DEA to prescribe Suboxone, which is one of the primary treatments for substance use. OASIS, with 28 Suboxone waived prescribers for Ulster County, yet when we took out the ones that didn't take new patients, that didn't take insurance, or were no longer practicing, it turned out to be 2. This was as of last year. We have increased the number who are treating, but because of COVID, now telemedicine has greatly and dramatically increased access to those providers, so that, for instance, many of the treatment providers throughout the Hudson Valley are now offering telemedicine services. Institute for Family Health, which deals with low-income populations, mostly folks who have Medicaid insurance or who pay for their services on a sliding scale, or maybe not at all if they don't have the funds, and now access medication-assisted treatment directly through a navigator that Institute for Family Health has set up. Narcan is a medication that immediately reverses the effects of an overdose, and it's used for immediate harm reduction. All of the many first responders in Ulster County carry Narcan, but individuals can also be trained. It's a very simple 15-minute training to carry Narcan, and when administered quickly, it can reduce an opioid overdose. But when COVID first hit, there was this people, the sites where people could pick up Narcan supplies shut down, like Families, walk-in centers in New Paltz, Kingston, and Woodstock, closed because of safety concerns, so people couldn't really get access. But in the 4 or 5 weeks since that happened, we set up virtual training for Narcan. We set up direct delivery to individuals for Narcan supplies. We set up text lines where people could text in and get Narcan supplies and training on the spot. The National Guard, in partnership with Samadi and Ulster County Youth Bureau, is doing targeted Narcan trainings in high-risk neighborhoods and with high-risk and vulnerable populations throughout Ulster County. This is all, as a result of the response. So these are some of the positives that have happened, and we hope that that post-COVID, that the DEA and OASIS will allow these virtual telemedicine treatment services to continue, because prior to COVID, folks had to have in-person meetings, at least initially, to get medication-assisted treatment and other types of opioid use disorder treatments. That was waived during COVID, and I think that OASIS and the DEA have seen, that it dramatically increased access to services, and that's been a real plus, and we are all advocating strongly to have that continue post-COVID. access to treatment services were also restored in many places. So we got, we really pulled together all the community partners in Ulster County to really get them to share information on a really timely basis about what services were still available. We now revise our services, our listing of services every 3 days, so people have like really updated information on where they can get opioid use disorder services. As I said earlier, access to Narcan has been dramatically increased, and we now are working on a longer-term project with Ellenville Regional Health Network and Ulster County to establish the same kind of data-driven rapid response risk mitigation teams that were employed in COVID to deal with the opioid crisis. And we are going to take it beyond just emergency immediate response to follow individuals throughout the continuum of care, treatment, and recovery, so people don't recycle back into recurring overdoses. So those have all been pluses. Those have all been like kind of lessons learned from COVID that we've been able to apply to another epidemic, which is the opioid epidemic. In terms of reopening, these are some of the guidelines that New York State has put forward as measures of whether a community, the metrics as to whether a community can safely reopen. So there must be a 14-day consecutive decline in local COVID-19 related hospitalizations and hospital-related fatalities. Counties must maintain a 30% hospital surge and ICU capacity in case COVID were to come back and there were to be a surge in cases. Counties must have 30 tests per 100,000 population available. That would be 5,400 tests available at any given time in Ulster County. Counties must have 30 contact tracers per 100,000 population. So that's 54. That would be 54 contact tracers available in the Ulster County, and counties must follow other New York State guidelines regarding the phased reopening of different sectors, different organizations, and different businesses. So, nowhere in New York will there be a wholesale, across the board reopening. It will all be phased. It will all be depending on sector, depending on your type of business, depending on the metrics in your community and in your region. And all of those will be continually monitored and assessed based on the data to make sure that that COVID is not making a comeback, and that we're not. And that we can be ahead of the curve in terms of reacting to any actual or suspected increases. So, so the big lesson I think that we learned from observing the amazing community response to COVID, both on a governmental level, on a community partner level, in terms of nonprofits, in terms of individuals rolling up their sleeves and volunteering and helping their neighbors and friends and really working for our community, is that there was a lot of innovation and a lot of partnerships that were created and connections that were created and connecting of the dots. And it's one of the things that we've talked about for many years in the Healthy Ulster Council in terms of dealing with other chronic diseases, is that Ulster County has amazing assets, really dedicated people and dedicated organizations throughout the county. And when you connect up those dots, and when you bring those assets together in that notion of collective impact, you can, the result is tremendous. And that, basically collective impact is that a community comes together, works together with, toward a common goal, with everyone contributing their ideas and efforts. And when that happens, the total result is much greater than the sum of its parts. And that's exactly how communities become healthier, more vibrant, and more sustainable. Not only in dealing with, emergencies as they come along. COVID is not the first, and it won't be the last. As we saw from, opioids and other disease conditions and chronic diseases like obesity and child obesity and diabetes and all of the others. But when a community, really works to strengthen its network of people and increases those ties and increases those collaborations, the community indeed does become more vibrant, more resilient, more sustainable, and it won't make emergencies go away, but it will dramatically enhance the way that our community is able to cope with them and grow from them. And that's really it.
So our next speaker, I'd like to introduce, and then I'll give them a chance to introduce themselves. We have with us today Evelyn Wright, the Deputy County Executive of Ulster County, and Amanda Laval, the Coordinator of the Ulster County Department of Environment. They will be speaking about Ulster County's Project Resilience, which has been a really incredible project put together so quickly in our county to address the emergency feeding needs of so many people. So Amanda and Evelyn, welcome. And you should be able to share your presentation, and I just give you a chance to say hello and introduce yourselves first.
Thanks so much, Melinda. Thanks for inviting us to be here. I'm going to let Amanda share her screen, and maybe while she's doing that, I'll just give a brief introduction before turning it over to her. For those of you who I don't know, I'm Evelyn Wright, relatively new at Ulster County. I think I'm in month 4 now as Deputy County Executive, and I work with the departments of the Environment, Economic Development, Employment and Training, and Tourism. And I really appreciated Vin's overview of the Ulster County COVID response, and thought maybe I'd just say a little bit while Amanda's getting set up about the genesis of Project Resilience. After we got the public health response and the whole emergency operations center that Vin was talking about set up in the, well, we were preparing before we had our first case because we knew it was coming, but really that first week after our first case was really focused on public health response. And it was Monday morning of the second week when we were talking about, okay, now what's next in terms of helping the community through it? And it was really clear to us that there was a tremendous amount of anxiety in the community. People were afraid, people were having their lives disrupted, didn't really know what was safe. And what we really realized was that, if we could make sure that everybody was fed and knew where their meals were coming from, that would greatly reduce the level of anxiety and fear and really help people feel taken care of. On the other hand, we were seeing all the businesses shut down and really wanting to do something to help keep dollars circulating in the community. And that was really, those two observations were really the genesis of this. So this effort to raise funds, track needs, and purchase meals from local businesses to meet those needs, and then work with volunteers to distribute them, was really created in the course of about a day. And that same day, Amanda, who's our director of the Environment Department, for those who don't know her, I think most of you do, had said to me, we're still working away on our environment stuff, but if there's something that we can contribute to the emergency response, let me know. And I said, well, actually, would you be willing to take this on? And I just want to give the most extreme thanks to Amanda and her whole team, because they said yes and they took it and they ran with it. And in less than a couple of days, they had a plan worked out and were delivering meals 4 days later. Just incredible what they set up and what they managed in such a short time. So I'm going to let Amanda talk you through the details and some of the size of the program and its impacts and what's coming next. The last thing I want to say is just a second on what Vin said at the end about collective impact. You know, it was really clear to us that the reason we were able to set this up so fast, other than the incredible logistical skills of the entire environment department, it was the relationships within the community, and the fact that everybody was willing to jump in and work together, and we were able to draw together the funders and the United Way to help us with the funding, and the community foundations, the restaurants, the incredible municipal networks of volunteers and municipal officials. Really, we saw the power of those networks and those relationships in the community at play here. And definitely gives us something to think about in terms of strengthening the health of the community going forward. So with that, I'll turn it over to Amanda.
Hi, everyone. I just want to check in first because are you seeing just the slide view, Melinda, improve?
So if you could just go to the slideshow and start from beginning, we'll see just the slides and not the slides on the left.
No, sorry. Nope, I can see the slideshow, but somehow it's just showing you. Oh boy, I know sorry, one moment.
That's okay. This is one of the technical challenges of Zoom meetings, and I think you're not alone in experiencing some of these difficulties.
Oh,
but
gosh.
we will.
All right, hold on one second, because we did this.
We'll solve these things one problem at a time and move forward.
All right, I think it was Katie who had coached me through it before. I'm sorry if I can.
Yeah, but it was a different problem, so I have no input to offer this time.
Okay.
Yeah, I mean, we can certainly move forward with it this way. It's just we're seeing the screen where you would normally be in your home screen with it. Ah, you did it.
That's it.
Yay.
Got it?
You got it. You're set to go.
I'm not going to touch anything. All right. Just pretend that little interlude didn't happen. That was really, thank you, Evelyn. And I think that really captures it in so much. And what I'm going to do is just talk a little bit more about the details. And, like Vin started to allude to, what we're seeing is the strength of all the different groups and kind of knitting them together, or the links of the chain that then is able to respond across the community to this crisis. And Vin is interpreting it through how does this how can you harness this experience to think about the response to the opioid crisis or health crisis. And of course I'm thinking about it through the lens of environmental initiatives and climate change, because that's my frame of reference. But I think it's a really powerful experience for us all. And, looking forward to thinking about how this is going to really inform our work for years to come. But right now, we are still kind of firmly in the trenches of the operation. So I'm going to take you through just some of the numbers and kind of some of the logistics of what we have done to date. So again, we were really, Department of the Environment is kind of has the team here, and I have to mention them all by name because it's just been remarkable. My deputy here, Nick Vazda, Europa McGovern, Ben Gannon, and Aaron Bennett, and myself have really been working on this full time and then some since March. But this was the county executive's vision to really link. The goal of the project is to feed people in need, right? One of the most basic needs human beings have is to be fed. while they're sheltering in place, or because of economic impacts of COVID-19, and simultaneously support local restaurants who were responding to this absolutely abrupt shutdown in their businesses. Literally cases and tons of food in freezers and fridges, and no way forward for them to think about how they were going to use that. The county executive was able to secure $2 million in funding within hours, and we used a simple web enrollment for people who had need to be able to sign up, and also for restaurants to be able to express their willingness to participate in the program. So this is the Daily Freeman from the day after the press release, which was March 18th. Meal delivery started on the 20th of March, which was that Friday. So right now, we are kind of winding down what we're calling phase 1 of Project Resilience, which started with deliveries on that Friday, March 20th. And we'll be doing the last phase 1 deliveries this Saturday. So that's 60+ days, about 9 weeks of meal deliveries. We're probably going to end up around somewhere about 130,000 prepared meals produced by local restaurants, delivered by volunteers to people in need. What we're also doing right now is transitioning to phase 2, in which we still very much want to support people in need in the community, but we're trying to look at ways to help them connect with resources that can help sustain them and are in a more comprehensive way than a prepared meal 3 times a week. If it's financial, if it's logistics, getting groceries, if maybe they need other types of resources, let's help them connect to those now that kind of this existing safety net has kind of adapted to the COVID crisis. So right now we're kind of in this break point between phase 1 and phase 2. However, we are also transitioning to groceries, which is really able to provide a lot of food to family in needs, and we're working with all sorts of emergency food providers, food pantries, and organizations across the county to do that. So here's just a little snapshot of kind of the arc of the first 2 months with the program, and not even so, because it only goes from March 17th over here. I think you can see my mouse, to May 4th. We went live with the web form right here, and you know, each one of these bars is how many people signed up for Project Resilience in, you know, that day. And we got to our total enrollment right now is each day there's about a request for over 9,000 meals, and that's from about 3,400 separate households. So 9,000 meals, 3,400 separate households, and definitely within the first weeks, you know, before stimulus checks, before, you know, expanded unemployment, things like that, that was the most pronounced need that we saw. And if you can see here, the slope of the line was pretty steep through here, had us all really nervous for a while about how many people were expressing need and needed help in the community. How the program works is that we are absolutely dependent on these municipal distribution teams, headed by, in some form, the local municipal leaders with volunteers in different formats. And there's between 16 and 20 of these teams organized throughout the county to serve the Project Resilience meal recipients, which we have meals requested in 23 of the 24 municipalities in Ulster County. Nobody from the town of Hardenburg, with a population of 250, signed up for Project Resilience. That was our only miss across the county. These are some photos from the large scale. Over on the left-hand bottom corner is the Kingston distribution site. which, spearheaded by the Kingston Emergency Food Collaborative. Project Resilience provided meals to the Food Collaborative in their effort to get those out into the community. At one point, I think Project Resilience was supplying up to about 1,800 meals a day to the collaborative, and they were distributing, I think at the high point, somewhere around 2,500 plus meals per day out of the YMCA in Kingston. The middle bottom picture is the distribution center that the town of Saugerties set up. They were mainly doing pickup, and again, over 1,000 meals per distribution day. Top right-hand corner is the town of Olive, several hundred meals per distribution, a little bit smaller of an effort. And local distribution teams also rely on volunteers, of which Senator Metzger was one and had posted fairly frequently about the effort, so I had to throw in her social post on the bottom right there. Meals delivered. I said this in the beginning that we are probably going to end up somewhere around 130,000 meals delivered. This is a tally through the first bit of May here, where we're over 100,000 meals. But again, you can see the numbers of meals as it was climbing, and I was likening the whole operation to being on a treadmill when somebody, just when you're used to the pace you're going, or you think you've kind of can manage it, somebody's increasing the speed. And that's what it felt like with this. At first we started at several hundred meals, but pretty soon we were over 1,000, then we're over 2,000, then we're over 3,000, and just kind of winding up this machine and kind of procuring and getting the meals out to the volunteers to deliver. Restaurant participation can't happen without restaurants, and just an amazing and from my standpoint, almost unexpected embracing of the project from the restaurants. They really, we had over 160 restaurants sign up to participate as part of the program. We would order anywhere from, we've been ordering anywhere from 25 to 200 meals from a restaurant for a given distribution. They're sharing that. There's an incredible sense of pride in supporting the community that way. They are reimbursed for these meals. However, this is also a labor of love, and they really, in many cases, go above and beyond. And from my standpoint, it's been great that they've been willing to share that on social media, because we've been able to kind of capture some of those pictures and kind of share that enthusiasm. Here's just a graph that lists some of the restaurants, again, all over the county, around 160 that have participated in the program. And this is a snapshot of the number of orders that we have to place on any given day to meet the meal demand. So it's regularly over 40 meals a day, which is a pretty good administrative burden, if I can put it that way. Just logistically, we have to place the order, confirm the order, make all the logistic arrangements with the municipality and their local distribution team in order to get the meals, and then have them on a schedule. So that's just kind of some of the back end that we do. But this has been really important, that each one of these orders is helping to sustain these restaurants through a very difficult time when their business model has just been either obliterated or significantly upended, and that they're trying to transition to curbside or takeout when maybe that wasn't their business model. Again, just some more social posts from the businesses. Just love how they're sharing, how they're engaging with the volunteers, how they're engaging with the community, even businesses sharing about how to support Project Resilience and kind of the fundraising aspects of it. From the county end, there's stuff that goes on in this office that I alluded to, municipal coordination, ordering, logistics, bundling documentation for payment for the restaurants. but we've also had tremendous support from county staff, like to drive around and pick up meals and get them to the local teams. We've also pretty much every day for the last month plus, we've used our area transit, and we've used this small bus here on the right, and we have awesome drivers and support from UCAT in which they go around and pick up meals and ferry them to the distribution points. They're right now, and it's just a great integration, and this was something that the county executive had kind of thought right off the bat, which was we're not driving around doing as many bus routes right now. Let's use that, excess capacity in this moment from UCAT to serve this purpose, and it's worked really well. Also, just tremendous outpouring from individuals. This is just a tiny snapshot of folks who are posting on social media about getting meal deliveries, notes that have come to United Way, who's a very important partner with the county on this project. And we get a lot of these, which is great. It's just one less thing for people to think about right now in the midst of the crisis, and especially in that beginning moments where people didn't know if they could get out safely, or if the grocery had food for them, or any of these other questions, that they just had the reassurance of having knowing that there would be a meal. Project Resilience has also, again, been really supported by the community. In addition to the foundation funding that the county executive was able to line up, there have been over 1,000 individual and small donors. You can see these on the GoFundMe page, which is run by United Way, and just some beautiful comments as far as people seeing how this is supporting the community. In addition, private donations, in the $10,000, $25,000, $50,000 range, as well as a lot of corporate and also charitable foundations throughout the Hudson Valley supporting this. And it's just a testament to the community that's here, that they want to support each other, they want to support the businesses, they want to support individuals in need. So phase 2, again, is this pivot to doing some more groceries, and this will allow us to continue the program as we kind of suggest that people look for, if they still have a need, that they look for some kind of program to kind of help meet that in a more sustainable fashion. But we're also very excited about networking with the emergency food providers to provide a little bit of funding to help with groceries. And we've seen this on many different scales. Right now, People's Place is doing groceries for at least 90 families a day. And they're not just in Kingston, they're in the town of Esopus, all the way up to Shandaken, kind of all around. We're also partnering with Roundup Valley Food Pantry, Ascension, Community Action. We've been in touch with many, many emergency food organizations around the county about making sure people are being fed, and we're connecting them to food pantries. And in a lot of places, this is not necessarily, these folks haven't maybe necessarily needed this kind of support before. So part of it is about, getting them in touch with those resources. So that's the end of the prepared presentation that I have for you all. So I'm happy to take any questions, or if Evelyn wants to expand on anything, or.
No, thank you, Amanda. That was great. Yeah, we're happy to take questions.
So I'm just going to remind everyone, because we do have so many people in this meeting, we are doing questions in the chat. You can just type your questions in the chat. I see we have some comments as well. One says, thank you, Project Resilience. Wish it was available in Sullivan County. My families and I work in Kingston are currently out of work and are very thankful and grateful for the meals they have received. So a lot of people are saying thank you. I do have a question. How do people sign up for the grocery delivery? That came from Janie Greenwald.
What we're asking is that they call the COVID hotline. And again, those folks might just ask them some questions to see if, you know, have they been in touch with other resources? You know, have they considered applying for SNAP, WIC, something programmatic support like that? Or, you know, is this a short-term need? And kind of it's a, I would like to call it like a gentle screening, just kind of reminding them about some of the other resources, but certainly then they have a spreadsheet that they can enter their name into. So call the COVID hotline.
Yeah, and I'll just add a little to that if I can, that this transition dovetails with some work the county's doing to really expand the COVID hotline into more of a county services contact center. So what we saw a few weeks ago is that calls to the COVID hotline were increasingly becoming about things beyond just immediate health concerns, that people were calling about their difficulties getting unemployment, that they were calling with concerns about businesses that were open or were not open, that they were calling with food concerns, all kinds of things. And so we are working on really transitioning that call center over time to being a one-stop entry point to county services. And so they're starting with a limited group of services, but including some of the most frequently requested things. So how do I sign up for SNAP? I need help getting unemployment. I need help getting job training or finding a job. And so what we'll be doing is when folks want to sign up for phase 2 of food assistance, the call center will be working with them to determine what services they're eligible for and how to connect them with the folks who can help them sign up.
That's great to hear. That'll be really fantastic going forward.
We're really excited about it.
Yeah, that's great. We did see another question. I see if it's been answered in the chat. And that's, there was a question about whether or not this project was linked with Project Manna. And of course, the answer was yes. Is there anything to expand upon in that, Amanda, or does that pretty much answer it?
That's Project Manna is a group of organizations, area nonprofits who are willing to help folks do their shopping. Because a lot of times this isn't about a financial kind of issue that people are responding to, but they don't know how to like actually get food from the grocery store to them. And Project Manna is a great group, I think, of 3 area nonprofits that are willing, have volunteers that are willing to do that work. So again, it's about, and this is where it's like this group, it's such a great, and what Vin was speaking about earlier, that you're linking with all these really unique and great resources and supports within the community that kind of already exist here. But it's now about kind of rethinking them as far as how they respond to COVID and the current crisis. So it's taken a little while for this, you know, new ecosystem to kind of adapt to the current situation. But it's one of the things that we're seeing and that we're hoping that Project Resilience and then the expanded COVID, the support hotline can really do.
So we have another question about if people who are already receiving meals, are they being contacted about the change to groceries moving forward?
So everyone that has been receiving meals has received a 2-page flyer about the change, about the end of phase 1, as well as a list of all these resources, as well as being told or that they can call the COVID hotline if they have any questions or if it's hard for them to connect with those resources. We also did a mask distribution this past week and this week, along with some CDC guidance on how to run essential errands. So we thought it was also really important that people kind of have some of the new tools that you need in order to kind of emerge into society when you have to. So.
Yes. That's great. Do we have any other questions for Amanda and for Evelyn? And certainly, do we have any questions or comments on the first presentation on addressing the COVID crisis within the county, and of course, its special link to the opioid response? Okay. We do have a few moments left in the meeting. What I would suggest, being as we do have a little bit of time, if we don't have any other questions, is I would give folks a chance. Katie, perhaps you can help with this. We can unmute everyone and just have everyone say who they are and their organization, and that we will know who's in the room. So if we could just start with Carrie. I'm going to go cross out what's on my screen. It will look very different on the screen. So, Carrie, you want to introduce yourself? I think we'll move on to Christine.
Christine Noble from Ulster County Office for the Aging.
Deb.
Hi, this is Deb Jones from the ARC Mid-Hudson.
And Katie Clayton.
Hi, yes, I'm Katie Clayton from ARCAL. I'm the supervisor of community-based case management.
Courtney.
I'm Courtney from CCE.
And Kristen. Okay, how about Lynette Vargas?
Vargas from Maternal Infant Services.
Eric Van Gasback.
Yes, Ulster County Recovery Specialist with People USA.
And Trish Sina.
I'm Trish Sina with the Ulster County Probation Department.
Colleen.
I'm Colleen Jones with the Mid-Hudson Problem Gambling Resource Center.
Leilani.
Yes, Leilani Yizer-Reed from the Mid-Hudson Problem Gambling Resource Center.
And then we have someone from People USA.
Jody Brunetto, People USA, Ulster County Peer Advocate.
Sharon Williams, Adoptive and Foster Family Coalition.
Michelle.
Hi, Michelle Hirsch was Family of Woodstock Family Peer Advocate Supervisor.
And Amanda Quintana.
Hi, Amanda from the Mid-Hudson Problem Gambling Resource Center.
Dakota.
Hi everyone, Dakota Motika, Health Specialist Assistant with the Early Head Start programs for Ulster County Community Action.
Great. Doreen.
Hi, this is Doreen Morris. I am the Ulster County Care Coordinator with People USA.
Danny.
Hi, I'm Danny. I am the Ulster County Recovery Specialist at People USA.
Great. And did I miss anyone? Okay, I want to give opportunity for, Gilbert, I did miss you. You want to say hello?
Yeah, Gilbert Marrero, Family of Woodstock, Adolescent Youth Services.
Great. So one of the things, Kristen, you want to introduce yourself?
Hi, yes. I'm Kristen Kessler. I'm the dietitian at the ShopRite of Kingston. I hope that you can all hear me. I have a face mask on right now.
We got you. So, okay, and also with us is Sean Bailey from Family of Woodstock Prevention Services. If there's anyone that didn't get a chance to say who they were and that they're on the call, please take a moment to do that.
This is
Okay.
Ray.
And I'd like to, there we go. We knew we were missing somebody. So I'd like to also give opportunity for our speakers to share anything else, and that would also include Ben and Stacy, as well as Amanda and Evelyn. If there's anything you'd like to say before we thank everyone for joining us.
We're just really appreciative of everybody making time to be at this meeting today, and we hope that you'll continue to follow the Ulster County COVID-19 website. There's that great data dashboard that's going to be informing us about the phases and whether we're going to be able to continue opening everywhere, monitoring how the infection rate is going. So keep a watch on that website. And on our social media pages as well, we're posting a lot of new information. I'm sure some of you have seen that there was a barber shop operating in Kingston. And so we're asking people that were exposed to make sure they get tested. And so you'll keep up to date by following the county social media and the health department's page as well. If you have any questions, feel free to email me and Vin and Melinda, and we're happy to help find the information. But also the phone bank has great information for everybody. So keep that on speed dial. And if anybody else has something important to share, maybe we have time for that.
I want to remind everyone that if you're looking, I mean, I can put our emails in the chat, certainly Stacy's, but it's also on the bottom of the agenda that we did send out to you. So you do have that if you don't have it already, but that's certainly there. So if there's not anything else that, any more comments that people want to make, or don't have any other questions, I just want to thank you all again for attending the meeting. Be on the watch for more information from the Ulster County Department of Health and Mental Health, and certainly from the County of Ulster. We're so appreciative of all of their efforts. This has been an amazing couple of months, and they've done a wonderful job navigating it. So we will be scheduling another Healthy Ulster Council meeting. We've been scheduling them bi-monthly for several years now. We anticipate doing another one by Zoom, most likely, as we stay safe. And we'll certainly invite all of you that are new to the group that I haven't seen here before. We'll certainly get that invitation out to all of you. So thank you again for coming, and be well, be safe, wear your mask, and yeah, take care.